Hello, everyone. This is Dr. Eric Fethke, your host here at the Pursuit of Health podcast. And I thought we would today go back to a format that I've used before, which is just me and you, just talking about a topic that is based on a patient story. In this case, several stories I'd like to share with you. And it's a topic in a format that I call case studies from the heart. Again, it's how we often review patients as physicians together when we're talking about planning their care, are going over a situation that must be a little more complicated, that had a good turn or a bad outcome. And this is how we as physicians use patient stories to help us care for patients and learn to do better and better each time. So I thought I would continue in that format on case studies for the heart, and that the topic today would be something that I've been thinking a lot about. And that is the idea or the philosophy of anger as a disease, or on the opposite side, perhaps anger as something that can be used as a constructive force. And I really wanted to look at this from a medical standpoint and use a couple stories to illustrate my thoughts and ideas that I'd like your feedback on. The first story I'd like to mention, actually, I can mention a couple of these in the concept or the situation of sudden cardiac death in the young. I have worked with several groups, including parents locally in New York and nationally, who are working to try to reduce the incidence of sudden cardiac arrest and death and hopefully eliminate it by 2030, which is the goal of many people working in this area, including myself. And the first story comes from a young man who went out on a field to play a game, a lacrosse game. And as he was playing, and during one of the plays, he got hit in the chest by the puck or the ball. Suddenly, he collapsed to the ground, and everyone stood around and didn't know what to do. The sad news is that he did not recover. He did indeed die, and everyone was devastated because it was unexpected. He was completely healthy. Well, his parents, who are the Acampora family, later on, after their grief and their anger and frustration, created the Louis Acampora Foundation, which I have worked with in New York, and later on turned their anger into a positive force. Now, they were angry for many good reasons. One was that nobody knew what to do and nobody recognized the situation. Through their work, years later, people started making the connection to what was known as commotio cordis, where the heart suddenly gets stunned. And again, most recently, people became aware of this in professional football when Damar Hamlin got hit in the chest by a helmet and had the same thing. And he was able to be resuscitated and get back to his life. But when Louis Acampora, the son of the Acamporas, had this happen, people really didn't know what to do about this, especially at the more junior high school level. And they were obviously angry, but they turned around and instead of running and hiding, which they had every reason, they instead turned around and created this society and a group of people around them to eventually create awareness and interventions, including the use of the AED or the defibrillator on all sports fields in New York with Governor Pataki at the time, and this became the Louis Acampora Law and has resulted in many young people's lives being saved. Well, another similar story was of someone years later playing on a football field and they collapsed during the game. People called the ambulance. They were doing basic CPR, but they didn't know that they needed a defibrillator. Well, when the ambulance came, the ambulance arrived and asked, where the defibrillator was. And they said, we don't know. Well, he did not survive. This is a very quick summary of the details, but the most important part was that child did not survive. And later on, they found out that the defibrillators were on the school property and no one knew where they were. And of course, that family was also extremely angry because of the lack of awareness and the delay in response that resulted in their child's death. And they too, later on, became part of a driving force, an advocacy force to make sure that this didn't happen again, and working in the area of AED awareness, sudden cardiac death awareness, and making sure that everybody knew where these devices were and how to use them and keep them up. They really, again, had every reason to be angry, but they chose a different path. Well, I've had recently my own story uh, with a patient that made me very angry. And thinking about these families, I said, look, if they could turn anger around, maybe I could as well. My story had to do with a young man who was in school. He had was a patient of mine. He had a known heart condition in which he required a pacemaker to keep his heart pacing fast enough. He had had this since he was an infant, and suddenly in school, he sensed when he stretched and reaches his arms over his head that his heart suddenly slowed down. He felt as if something had significantly changed. He felt dizzy, felt a little winded, and as he drove to meet me in the office, he actually became nauseous and vomited, which is a sign that he was having less blood flow to his body, in this case, his stomach and intestines. And that low output situation became something that was urgent in my office now. And I realized that his pacemaker was no longer working, and I called the local ambulance, which I had done many, many times before, and said I need to take him down to his hospital in the city where he had had his care. And when the ambulance team arrived, they were a local team and said that they could not travel to the city. They were only allowed to go locally. Well, I knew that if they took him back to the local emergency room, that would just delay things. They could not do anything there at the local community hospital. The local community hospital actually said, the director there, the doctor there said, I agree, and you can divert and basically go straight down. I give you permission to do that. Well, in summary, we called about 4 or 5 different ambulances in the community, and none of them would take him down to the city. They said they could not do that for many different reasons. And one of the companies that I had always done that with had been bought out recently by another company who was not willing to drive him down from my office. And in frustration, I canceled the last 2 patients of the day. And I got in the car and followed the family down to the city as I was carrying a defibrillator in the car, and our phones were in communication with each other if need be. We got down to the city. It was confirmed immediately that his pacemaker wasn't working and that he would need that changed, and he was admitted to the hospital. As he got out of the car to get to the emergency room down in the city, he was so tired and dizzy, he had to sit down. I had to put him in a wheelchair. This is a teenager who obviously shouldn't feel like this and not felt like that when his pacemaker was working. So I was angry. I was angry at the fact that I had no resources locally. I felt like things had, in many ways, gone retrograde. In the past, I had had better resources. I had worked hard to develop those locally, and they were now gone. And I was mad because not because I had to take time out, but because it was jeopardizing a patient's health and perhaps their life, and that I had to be put, and they had to be put, most importantly, the family, them in that situation. Well, I've been angry, and thinking about the other families in sudden cardiac events, I realize I've got to turn that anger into something more positive. Well, one of the concerns I've had lately is that I've seen anger actually turn into such a negative force, and anger as something that is overwhelming. And I think a lot of us have seen this lately. And I see anger as it promoting a division and hate rather than focusing on what we share, calling each other enemies many times, creating stress, fear, anxiety, and an inability to almost think clearly gets overwhelming. And I've realized that this has medical implications, not just mental health, but some of my guests recently have talked about stress, anger, anxiety, and these emotional aspects as leading to biologic disease, including heart attacks and stroke, as well as mental health. One of my guests, Jonathan Fisher, Dr. Jonathan Fisher, is a Mount Sinai and Harvard trained adult cardiologist who wrote a book about this subject, Just One Heart, and leads a national group at many levels to make this mind body connection, because he basically is saying that if we don't do this, it will overwhelm us. He explains how the culture of hate leads to individual and societal unwellness. And I really wonder, don't we all feel this lately, especially here in the United States? This includes problems such as cardiovascular disease, and negative forces such as this are literally making us sick. I don't know if you feel it, but I felt it. And it really makes me wonder why anyone would want to basically promote hate, separate people, literally locking them up if they disagree or hate with them. rather than reach out to our shared humanity. This promotes a sick society in many ways, a dysfunctional society where only a few benefit, and not just civically, but it also makes us biologically sick. And I've been thinking about this and literally worried about the health implications of this. Even though it comes up a lot in politics, I'm also thinking about it in terms of its health implications. Well, one of the people years ago who understood and thought about this a lot was a gentleman from South Africa, Archbishop Desmond Tutu, who worked with Mandela and in 1984 actually won the Nobel Peace Prize for his efforts to work against apartheid. But one of the main forces that drove him was his philosophy that we are all connected through our common humanity. Even if we think that people don't agree with us, our enemies, that the right way to approach this is not to hate them and not to see them as enemies, but to find that commonality that perhaps can unite us and solve some of these problems. He really believed that what one person does affects others. Therefore, an injustice to one is an injustice to all. Yeah, some of this came from his African heritage philosophy, but he combined it with his Christian beliefs as well and turned it into a very positive force and really stressed that if we divide each other and are separated versus finding our commonalities, that it is very dangerous and possibly destructive civic force in our lives, but also creates a lot of other health issues too. And thinking about this, it brought to mind an actual animal experiment that I really was struck by when I first learned about it, but it makes a lot of sense. This was an experiment that was documented in the Journal of Nature in 2003, and it was called the Fairness Experiment. It was first done with two monkeys, and the two monkeys had grown up lived together. They were part of a community. They knew each other, so to speak. But the experiment goes as follows. They're put into separate cages right next to each other. They can see each other. And then the human who is conducting the experiment is going to ask them to do something. In this case, give them a little pebble and hand it through the cage to them. And if they do that, they get a reward. And the reward is either a cucumber, which is kind of tasteless, but they've eaten it, or a grape, which they really like, grapes. So what happens is that the experimenter basically requests the pebble, the monkey on the left gives the pebble, and they get the cucumber. And they're like, okay, that's fine. Then the experimenter turns to the monkey on the right, who the monkey on the left can see, and asks for the pebble, gives him the pebble, and that monkey on the right gets a grape. Immediately, the first monkey looks over and you can sense the anger. They look over, they grab the cage, and they're frustrated. Like, why did they get that when I did the same thing I did? That's not fair. You can almost see them thinking this. Well, they go back to the first monkey, ask for the pebble. The monkey hesitates, but they give the pebble. They receive another cucumber. They actually take that cucumber immediately and throw it back at the human being. Like, I don't want this. I want the grape. That's not right. You gave the grape to the other one. Well, they go back to the second monkey, get the pebble, give a grape. That monkey's happy. Man, the first monkey is now livid. Well, this experiment has been repeated not just in primates, but other animals. And it really reflects the idea that there is a basic biological sense that when things are not fair, when they're not equitable, that is not right. Instinctively, there's something wrong, and it creates this anger. And it made me think about the anger and the divisions that are being created lately and the health implications again. But where are they coming from? And in much of it is a sense of unfairness. It's this idea of being unequal, inequity, whether that be at multiple levels in our society later, and whether that's getting worse and people are using this to continue to divide us. And that has health implications. Where are these inequities? Well, we've talked about this on the podcast. We've talked about it in terms of race, in gender, in geography, socioeconomics, all these different levels. And as these divisions get worse and worse, and the unfairness and the have and have nots get wider and wider apart, people are getting frustrated and angry. And then others can come in and use that frustration to say, see, you deserve better. They're getting more than you are. That's not right. You should not like them. They're your enemy now. You should hate them. And we should fight against this. And I'm really looking at this, sorry guys, from a basic psychological and biological and animal level. But it strikes me that that's almost what it looks like day to day, whether it's on social media, in the news. and in our body politic. And I even see it in healthcare in many different ways amongst different levels of people dealing with insurance companies, with administrators, between different institutions. There's this kind of frustration, and we're dealing with it not by finding our commonalities, but by pointing out our differences and literally pointing and saying, you are not my ally. You are not somebody I'm working with, I'm working against. And it really is getting very, very overwhelming. And I'm really wondering if any of you are feeling some of this as well, or whether or not you've decided to use your anger and turn it into a positive force, as some of the families that I mentioned have done. And I really think that that's the solution in many ways. We need to find and create an environment in which that anger dissipates, that we don't promote it, but we find a way to solve it. And of course, that's by getting rid of these inequities or working towards those. But it also has to do with the leadership level in many ways. We need leaders who create and promote the ability for every individual to meet their abilities to constructively contribute to society, maximize their potential and ambitions that are not just materialistic or selfish. And I really believe that, because at some point, material things don't matter anymore. People say, I don't care how much money I make or the materials I have. I'm still upset and sad if I feel that I'm not contributing or I'm not getting rewarded as much as others and my life is not as fulfilled. And if we create an environment that's more positive, then we get hope and joy back and a meaning for everyone, not just a select few people, a select group. And I think that this can really reestablish the idea of personal and collective health, and in many ways bring back some of the fundamental philosophies of our nation as a democracy, in which we all benefit. If we support the one, Desmond Tutu's idea, then we all benefit. Whether we agree with them or not, supporting someone, even if we don't agree with them, will somehow have benefits to us. Whereas to the contrary, if we knock others down and we don't support them, we see them as our enemy, are we creating an environment, a society in which we will all suffer in some ways, mental health, physical health, civically, etc.? So I'm not trying to take sides here. I'm not trying to have a political discussion, though it's not far to go from this discussion to political discussion. But I'm advising that we consider the health consequences of the political choices we make when we choose people who represent us at all levels, whether it's town, county, state, nationally. In the next few days, literally, we make some of these choices. Because if the people that we choose are going to foster division and anger and not unite us, I'm concerned that's going to become very unhealthy. Our nation will become sicker and sicker at so many levels. That to me should be the litmus test here, because that removes the anger, the frustration, the fear, and all these other things, and hopefully makes an environment where we literally feel better and are not so sick at so many levels. This is something I've been thinking about a lot lately. I don't like seeing people get angry at each other. I don't like seeing sides. It doesn't work. And then when I see heroes, literally people take loss and frustration and anger and turn it into something positive, I'm saying, well, if that can be done, they can do it. I'm just wondering whether or not that's just a much healthier choice. And that's how we should be thinking about who we choose to lead us in the coming elections and in many aspects of our life, and perhaps ourselves becoming part of the leadership and advocacy in some small way. So, these are just some of my thoughts. I really look forward to your feedback on these ideas, the idea of anger as a health issue or possibly as a driving positive totem force, and many of the other topics we've talked about in the past or ideas you'd like to talk about in the future. I can be reached at our website. That's ericfethkemd.com. That's EricFethkemd.com. And I look forward to your feedback there and on Facebook and Instagram. And I'm always open to hearing what you want to contribute to this dialogue. And I will definitely not be angry with any contribution you make, as long as it is a constructive one and it helps you and helps everyone here in this space as we continue along on this project together. So until next time, I'm Dr. Eric Fethke, your host here at the Pursuit of Health podcast, and I'm wishing you well in all your pursuits.